For our update today, to start with, our number of new test positive cases is 43 today, which brings us to a total of 1,013 people in British Columbia who've tested positive for COVID-19. Of those, 476 were in Vancouver Coastal Health, 348 in Fraser Health, 67 now on Vancouver Island, 107 in the interior, and 15 in Northern Health. In addition, we're up to now 19 long-term care homes or assisted living facilities, all of them either in Fraser Health or Vancouver Coastal Health, where we've had outbreaks of COVID-19. I will say, however, that this reflects a very low threshold for declaring an outbreak, and all of the screening that we have been doing and focusing on in terms of trying to protect our long-term care homes. We know we have two particular outbreaks that started early on, the Lynn Valley Care Centre, of course, and the Harrow Park Care Centre. And both of those are really full-blown outbreaks where we have a number of both staff and residents who have been affected, and unfortunately that is where we have had most of our deaths. But the other ones really reflect the fact that we have taken such an aggressive approach to monitoring, to testing, and to preventing illness coming into our long-term care homes. And the fact that we now have 19, but the vast majority of them have a single person, either a staff person or a resident who was detected with this illness. And we've been able to put in place the outbreak measures so that others are not affected, and people are effectively isolated or removed from the home in terms of the healthcare workers so that we aren't transmitting it. And I think that's a really important thing to recognize. So currently, as of this morning, we have 128 people who are hospitalized across the province with COVID-19, and of those we now have 61 people who are in ICU. So the ICU number is very close to yesterday, although I will say, as I mentioned yesterday, people go back and forth between the ICU or the high acuity units. We have had a policy very early on of ventilating people early to help them recover from this, and that is reflected by the numbers that are going in and out of ICU on a daily basis. So that's the census as of this morning. It's not the same 60 people that were in ICU yesterday, but it is the number who are now receiving critical care. We have 507 people now fully recovered and out of isolation, and we have an additional 5 deaths, unfortunately, 4 of them in Vancouver Coastal and 1 in Fraser Health, bringing our total fatalities now to 24. In addition, I want to report today, Interior Health is investigating our first large community outbreak, which involves a group of temporary foreign workers in housing at a West Kelowna agricultural business, Bylands Nursery. So this business has been closed to customers. Interior Health became aware of a number of the workers there with respiratory illness, and a number of them have now tested positive for COVID-19. The business itself is being quarantined, and everybody is able to be isolated effectively in the housing, the very good housing that is on site there. And we want to thank both the workers themselves and the owners and operators of the nursery in being fully cooperative, and everybody is being cared for very well, and the investigation is ongoing with Interior Health on that community outbreak. There's a number of things, as you're aware, that we've issued some guidelines on that have come out recently on the orders that we've put in place over the last little while. These guidance documents have come out so that we can have some consistency in the applications of the orders that we've put in place to protect people here in BC. So yesterday there was some detailed guidance around industrial camps. Later today or early tomorrow we'll have some guidance for municipal bylaw officers and other law enforcement officers. And while I can call on peace officers to help enforce orders, it is a last resort, as we talked about before. The way that we need to work together on ensuring that people are taking the measures that we need them to take, whether that's being in quarantine if you've been a contact of the case, whether that's being in isolation if you are sick yourself or you return from travel to a country outside of Canada. Those are legally enforceable orders by public health, but we know that most people are doing what we're asking them to do and are doing the right thing. So that is the approach that we need to continue to take, that we're all in this together, and that allows us to ensure that people aren't hiding things and aren't afraid of coming forward and working with us if they become sick. One of the other things that we have done in the last week is put in place a protocol, our first responder dispatch protocol for the pandemic. And this is really an important way to protect our non-paramedic first responders. As you may be aware, for many calls to 911, dispatch will dispatch not just a paramedic, but if, in particular our first responder firefighters who are trained in advanced first aid and other measures. And during a pandemic, when we know that personal protective equipment is so important for our healthcare workers, for our paramedics, and we want to avoid exposing as many first responders as possible, the protocol allows for paramedics to be dispatched only to most medical calls unless there's a need for backup from either police or fire services. So I think that's a really important measure that we want to make sure protects our non-paramedic first responders and ensures that our paramedics are able to respond effectively with the personal protective equipment that they need. Finally, I'll just say we are, as I mentioned yesterday, at a critical juncture. We are watching very carefully across the province. We are still testing around the province. We're testing our focused areas, as we've mentioned, on long-term care, on our hospitals, but we are also continuing to do our surveillance, our testing of any swab that is sent into the lab for respiratory testing, and our influenza sentinel surveillance network. So these are really important measures to help us understand what is happening. And this is our critical time here in British Columbia, the next 2 weeks. We must be true to who we are in BC, and we know that all of us, most of us, are doing the right thing 100% of the time. No one is immune to this virus, but everyone can make a difference. So we need you to do those things that we've talked about. Avoiding unnecessary travel, particularly to smaller communities where they may not be able to support you if you get sick and where we don't have as many resources. If you're older and you're more likely to have severe illness from this, please stay at home to reduce your risk, and we as a community will support you to do that. If you're younger, stay apart. That is our duty, to make sure that we're not connecting and transmitting this virus between us and bringing it home to those that we care about in our family and our community. So this is the time, as we've said in the last couple of days, it's to be 100% committed to keeping this curve flat, to not allowing a surge and an outbreaks in our communities. So taking care of our loved ones by doing your part, by staying home if you can, by staying apart, and of course by staying connected virtually.